Hello, everyone. Welcome to another session for the Wellness Wednesday. Today, we are going to talk about thyroid testing, which is extremely important to get a proper assessment of your thyroid gland. So, if you get a better assessment of your thyroid gland, you may have a lot of the symptoms, but to monitor if your thyroid function is proper or not, you may have to go for some blood testing, and that will give you some accurate picture of what's going on with the thyroid gland. There is also a non blood test that we are going to discuss about at the end of the session. um, so if you have any questions till then, you are most welcome to post it here. And thyroid, again, super important to know the function, because it is a gland that does govern a lot of our physical metabolism. It also governs a lot about your cognitive function, your energy levels, your focus, concentration, memory, um, all those signs, whether we're talking about your weight, whether we talk about your energy levels, that's all being governed by your thyroid gland. So that's what we are going to discuss today. So let's get started. I'm just going to open up some of the notes that I made. Okay, perfect. So let's see. Okay, so how do you screen for thyroid issues? So there are several ways you can screen for thyroid issues. One of the common ones to look at any structural changes is, your doctor may palpate the thyroid gland. You may see any swelling, any kind of, on palpation, you may notice any nodules or any growth here. One of the most common tests that are done is the ultrasound. So the thyroid ultrasound is a test that is done. It's not an invasive test. It is a test that is done to identify the size, shape, structure of your thyroid gland. It can help you understand if there are any nodules um, in your thyroid, or what is more of a structural abnormality. So that will be seen by the ultrasound test. Then there are a different panel of tests that are conducted on the thyroid gland. And this panel of different tests that are conducted on the thyroid gland can give you a better idea of the functioning of your thyroid. So, one is the screening test. So, number one is the screening test for your thyroid gland. And typically, the hormone that is measured for the thyroid screening test is the thyroid stimulating hormone, or TSH. So, TSH is the screening test. It is also used to monitor whether the medication, if you are someone who's on thyroid medication. So it is also the test that is used to understand if your medication dose is optimal for you or not, right? So that is why the TSH is done. Now, interestingly, thyroid stimulating hormone is not secreted by the thyroid gland. It is rather secreted by your pituitary gland, and it will respond to your thyroid hormone. So depending on if you have sufficient circulating thyroid hormone, you will have a normal TSH. If you have a really low circulating thyroid hormone, your TSH is going to be heightened, increased, in order to stimulate your thyroid gland to secrete more of the hormone. So that is typically seen in conditions of hypothyroidism. In hyperthyroidism, where you have an excess of thyroid hormones, that is the negative feedback loop. So your thyroid will signal your pituitary, stop secreting TSH, and that will end up with lower TSH values, right? So this is the typical hypo versus hyperthyroidism and the TSH values. Now, when we look at different autoimmune conditions, you cannot just rely on TSH, because often you will see that, an elevated TSH may also be in response to certain autoimmune conditions like Hashimoto's or primary hypothyroidism. So even though you have low levels of circulating hormone, your TSH is going to be elevated, which is kind of counterintuitive, right? And often you will see that people with Graves' disease or hyperthyroidism, the TSH levels will be low. And this is how often autoimmune thyroid conditions can go misdiagnosed or undiagnosed. So that is why TSH is a good test, but it's a screening test, and it is not a very definitive test when it comes to your thyroid gland, right? So 95% of individuals without a thyroid condition typically have levels below 2.5, and usually you want to look at a level between 0 to 2 or maximum 2.5. The normal ranges are 0, 0.5 to almost 4. Some people will take it as 4.5 micro international units as well. But if you have a higher number, then your thyroid functions something as amiss there, right? And this should also be done to monitor whether your dosage of thyroid, or if you're going through any kind of testing with your thyroid. This is something that is a really good indicator of monitoring. Now, the second test that we talk about are the specific thyroid levels. So there are four main thyroid hormones: T1, T2, T3, and T4. T4 is known as thyroxine, T3 is known as triiodothyronine, and they all depend on how many molecules of iodine are attached to those hormones, right? So, T4 is a prohormone, so it is 300% less bioactive than T3, and it has to be converted to T3 to be able to function, right? So if you are going to test for your thyroid hormones, only TSH is not going to help you. You have to check your free T3 and T4 hormones as well. T4, as I said, is the pro hormone, which will then convert to T3. And T3 is the main bioactive hormone. It is the hormone with the biological action. So, your amazing hair, your energy levels, maintaining your weight, your metabolism, everything depends upon T3. And free T3, free T4 will give you an understanding of the active thyroid hormone circulating in your body. If these are low, but your TSH is normal, you will have something called central hypothyroidism. So, for a normal TSH, you may still have low T3 and T4. Now, some practitioners will only test T4, but T3 is super important to get tested, because having an optimal T3, which is the active hormone, is super important than just testing for the T4, which is the pro hormone, right? And often when thyroid conditions, like you will see certain thyroid conditions or thyroid malfunction in pregnancy, you will see that low T4 is there. There may be a higher T3. That could also be a condition related to some imbalances that happen during pregnancy. Now, another testing that you have to go for if you are still having a lot of symptoms of thyroid condition but your hormones are normal, and this is something again that often does not get tested through the family physician. So you have to be able to advocate for your own health and really ask them to get it done. And these are the thyroid antibodies, right? So, whenever we look at antibodies, these are produced, especially the thyroid antibodies are produced in response to your body attacking your own body, right? So, our body tissues are tolerant to our self. Our cells, immune cells, are not supposed to attack our thyroid or our own joints or our pancreas or anything. So, when situations arise where the body starts attacking the body, that is called autoimmunity. The body lacks this self tolerance. It doesn't recognize that, oh, this is my own thyroid gland, I should not be attacking it. And that will result in different autoimmune conditions. So if you see certain autoimmune conditions like Hashimoto's, you will see that the thyroid function is really lowered, and that is kind of autoimmune hypothyroidism. You have a lower thyroid function. And then there is the other spectrum where you will see autoimmunity, where your body is triggering your own body to attack the thyroid gland, but here you're secreting a lot more thyroid hormones, and that is called Graves disease often, so you will see certain antibodies in both. Now there are different antibodies in Hashimoto's, and there are different antibodies in Graves disease. So Hashimoto's, you will see thyroid peroxidase antibodies known as TPO, or thyroglobulin antibodies known as TG. And often, when we are looking at Graves' disease, you are going to have more antibodies related to the receptors. So, the thyroid stimulating immunoglobulin, that is the marker you are going to see when it comes to the thyroid antibodies, right? So, these are some testing that you should ask your doctors to get for you, or work with a natural practitioner. You can work with a naturopath as well who can get this testing for you. Now, there is another kind of thyroid test that will tell you how your thyroid conversion is. So that is called the reverse T3. So reverse T3 measures how much free T3 hormone is there in your system, because reverse T3 is often produced when your body undergoes a lot of stress, and these reverse T3 molecules are going to bind to the thyroid receptors but switch them off instead of switching them off on. So all your metabolism, all the functions of thyroid get lowered if you are going through, if you have a higher amount of the reverse T3. And that is one of the reasons why this has to be tested as well. I already mentioned about the thyroid ultrasound. So often we will look at nodules. Sometimes that is a good way to identify and take a biopsy and identify if there is any thyroid cancer that's starting. Or sometimes these nodules can also be seen in different hypothyroid conditions, or even hyperthyroid conditions. So these are super important to know. Now, another simple test that you can carry out at your home without having a blood test, if you just want to assess is your function of thyroid optimal or not, is called the basal body temperature. So basal body temperature was developed by Broda Barnes, who was an MD, and he promoted like a diagnostic test for thyroid function called the basal body temperature test. And mild hypothyroidism, you may have normal lab results, like often even with TSH, a TSH of 3.5, 3.9, from a medical perspective your doctor may say, oh, it's perfectly normal, but you could have all the symptoms of hypothyroid, and the hypothyroidism doesn't show on your test. So basal body temperature is a fantastic way to understand what exactly is going on from a thyroid perspective. So taking the body temperature is super important. So one thing is, you can use the same thermometer for the entire duration. And do not do it when you're menstruating, because menstruation will often increase the body temperature, so we don't want that. um, so immediately upon waking up with little movement, you can place the thermometer under your tongue or under your arm, and take this temperature before eating, before you drink anything, or even you get up to use the bathroom, and take this temperature every single morning. Your armpit temperature usually is zero point 0.5 to 1 degree Fahrenheit, lower than the oral temperature, and you can record 3 days of recordings. And sometimes, I will ask clients to record for 10 days as well to get more of an idea of what's really going on. And if your average temperature is lower than 97.8 or 97.3, then you are going to suspect that there is hypothyroidism, right? So often making sure that you're not using any heated electric blankets at the time, or you're not drinking any alcohol, or you're not having a lot of stress or night insomnia, or any other illness like actual fever is super important when you do this testing. But you can just keep a simple chart, and that is going to help you understand how your thyroid function is, right? So in today's session we have talked about different kinds of thyroid testing. We've talked about TSH, we've talked about T3, T4, we talked a little bit about your thyroid antibodies, We also talked about reverse T3. Now, if you are someone who is struggling with your thyroid gland, and if your numbers are perfect, on the testing, but you still have a lot of the symptoms, please feel free to reach out. We can set up a one-on-one schedule, like a appointment, and we can discuss a little bit more about how normalizing your thyroid can be done with the power of Ayurvedic medicine. So, in Ayurveda, we look at specifically your diet, your lifestyle, we look at the stress management, but we also look at the root cause of what's going on. You have to understand your thyroid gland is the most sensitive gland in the body. And if you are someone who has a lot of inflammation, that inflammation can impact your thyroid. And because the conversion of T4 to T3 happens in the periphery, if you have a lot of inflammation in the body, you may not be converting T4 to T3 and having adequate levels of this active thyroid hormone. So, if you are someone who has a history of medication or who is taking medication and has all the symptoms, I've seen all kinds of, permutations, combinations of clients on thyroid test. So, feel free to reach out. If you have any questions, you can post it here. And if you need one on one consultations, feel free to reach out and we can schedule a call with you. Thank you for watching. Next session, I will be doing another one on thyroid. That's our topic for the month. And for those who are enjoying Valentine's Day today, make sure you give some love to your thyroid gland as well. It is the most important gland in your body, one of the most important, because the other glands like adrenals are also important. But make sure you give some love to your thyroid by eating less of the foods that are inflaming it, right? So a lot of the processed oils, canola oil, um, refined oils, if you minimize those, it's going to minimize the inflammation on your thyroid. So eat clean, eat lots of good fresh fruits, vegetables, eat some seaweed. We are going to talk about the diet related to thyroid soon, but make sure you show some love to your thyroid gland today as well. Thank you for watching. Bye for now.